Hello, and welcome to Healthy Care. In today's video, we're discussing a common yet concerning issue faced by many parents: diarrhea in children. We'll cover the common causes of diarrhea, ways to treat it at home, and when to seek medical attention. Diarrhea can be distressing for both the child and the caregiver, but with the right information, you can manage it effectively. Let's dive in. What is diarrhea? Diarrhea is the body's natural way of eliminating germs and toxins from the system. In children, it is usually characterized by frequent, loose, or watery stools. Most cases of diarrhea in children last for a few days to a week. While it may seem alarming, diarrhea is often the result of infections or other manageable causes. However, it's essential to know how to care for your child during this time and when to seek professional help. Common causes of diarrhea in children. There are several reasons why children may experience diarrhea. Some of the most common causes include viral infections. Viruses, such as rotavirus, are one of the leading causes of diarrhea in children. In addition to watery stools, viral infections often come with symptoms like vomiting, fever, stomachache, and headache. Viral gastroenteritis, commonly referred to as the stomach flu, can last anywhere from 5 to 14 days. Bacterial infections, bacteria like Salmonella, can also cause diarrhea. These infections are more severe than viral ones and often come with high fever and abdominal pain. Parasitic infections, though less common, parasites like Giardia can cause diarrhea, especially in cases where the child has recently traveled to countries with inadequate sanitation. Medication side effects. Diarrhea can be a side effect of medications such as laxatives or antibiotics. Antibiotics, in particular, disrupt the balance of gut bacteria, which can lead to diarrhea. Preventing dehydration during diarrhea. One of the main concerns with diarrhea is dehydration, especially in young children. It's crucial to replace lost fluids and prevent dehydration by providing the right fluids. Here are some important tips. Oral rehydration solutions, ORS. These solutions contain the right balance of sodium, potassium, and nutrients to rehydrate your child effectively. It's especially useful for infants and younger children, as water alone lacks the necessary nutrients to restore fluid balance. Breast milk. If you're breastfeeding, continue to offer additional breast milk to your infant during diarrhea. Fluids for older children. Older kids can drink a variety of fluids, including water, diluted juice, and ORS products. Popsicles can also be a good option to encourage slow rehydration, especially if your child has been vomiting. For any child, regardless of age, it's essential to monitor their fluid intake and check for signs of dehydration. If you suspect dehydration, contact a doctor immediately. Recognizing dehydration. Dehydration is a serious complication of diarrhea that can lead to dangerous outcomes if not addressed. Some warning signs of dehydration in children include dizziness or lightheadedness, dry mouth, dark yellow urine or a decrease in urination, no tears when crying, cool, dry skin, fatigue or lack of energy. If you notice these symptoms, it's essential to act quickly. In severe cases, dehydration can lead to seizures or even death, so do not hesitate to contact your healthcare provider. When to call a doctor. In most cases, diarrhea will subside within a few days. However, there are situations where medical intervention is necessary. You should call a doctor immediately if your child has diarrhea lasting more than 3 days, is younger than 6 months old, is vomiting blood, or has a high fever, over 100. For degrees Fahrenheit. For babies under 6 months, cannot keep fluids down, shows signs of severe dehydration, has blood in their stool, has a rash, stomach pain, or is very lethargic. In rare cases, diarrhea may be a symptom of more serious conditions like irritable bowel syndrome, Crohn's disease, ulcerative colitis, or celiac disease. If diarrhea persists for more than 2 weeks or you're unsure of the cause, schedule a visit with your pediatrician for further evaluation. Treatment for diarrhea at home. For mild cases of diarrhea, there are several home remedies and treatment options that can help alleviate your child's symptoms. Hydration. As mentioned earlier, keeping your child well hydrated is the #1 priority. Use oral rehydration solutions, ORS, or offer small amounts of fluid frequently. Probiotics and yogurt. Studies show that yogurt with live cultures and probiotic supplements can help restore healthy gut bacteria, particularly if the diarrhea is caused by antibiotics. These friendly bacteria help restore balance and reduce the frequency of diarrhea. Diet. If your child is able to eat, opt for easy-to-digest foods. The brat diet, which stands for bananas, rice, applesauce, and toast, is often recommended for children with diarrhea because these foods are bland and easy on the digestive system. Rest. Encourage your child to get plenty of rest. The body needs time to recover from illness, and rest will help the healing process. Medications. Avoid giving over-the-counter antidiarrheal medications unless prescribed by a doctor. These medications can sometimes worsen the condition or hide serious underlying issues. Food poisoning and diarrhea. Food poisoning can also lead to diarrhea in children, often accompanied by vomiting. The symptoms typically appear within a few hours of consuming contaminated food and may last up to 24 hours. Similar to viral infections, treatment for food poisoning-induced diarrhea involves keeping your child hydrated and monitoring their symptoms. If you're concerned, don't hesitate to contact your doctor. Conclusion. To wrap things up, diarrhea is a common issue for children, but with the right approach, it can be managed effectively at home. Stay vigilant for signs of dehydration and don't hesitate to consult a healthcare professional if you are unsure about the severity of your child's condition. Thank you for watching Healthy Care, and if you found this video helpful, please like, subscribe, and share this video with other parents. Stay tuned for more tips on keeping your child healthy.